Just a girl. Finishing up some documentation before I go to bed. Okay, so one of my favorite things about my job is that I work with tablets. Um, I used to work with a Mac computer, which I absolutely loved. I love Mac computers. I use one at home, but when you are in community, it's very hard because then when you get to the patient's house or every time you get somewhere, you first have to set up the Mac computer up on Wi-Fi before you can do what you need to do. Whereas with this one, come to the same. So unless I'm in an area where I have no service, which does happen, I'm pretty good to go. I just start up my tablet. And also, it's so much easier to carry. It has a strap on the back. It's a basic Galaxy. Um, so yeah. But anywho, nightly routine for me is documentation. I because of the kind of nurse that I am, some people document while they're at patient's home. I generally don't document in patient's home except for things like vital signs that I don't want to forget. Because I prefer to be present and to be looking at them and looking eye to eye and having that conversation. Um, and then when I get home, I document. So just that's my way of doing it. I've always done it that way. Does it mean that I spend more time working? Yes, but I feel like I also provide better quality care because I'm able to pay attention to the patient. And to be honest, a lot of my patients, one of the things that affects them when they go to hospitals and facilities is that they feel like they don't get enough time with clinical providers, nurses, doctors. They don't feel like they're getting as much attention as they want. And I understand why that is the case because, in a lot of facilities, people are really short for time. But the way my particular work is set up, I have time. I choose to have time in a lot of situations as well. So, for certain tasks, I can get in, get out. But for things that require a lot of education, especially when it's start of care, in a home health environment, I try to make sure that I make time. For each patient, I budget at least an hour of in-home time where I can sit down with them and talk and ask what their concerns are. Sometimes I also talk about things that might not be related to the direct diagnosis that I was brought in for that might affect their health. So, but anyway, yeah, that's what I'm doing right now. It's 10:17. I hope I'm done with this person's documentation soon so I can go to bed. But anywho, have a good night.